Hi, this is Robert Burk and my nurse Carol Michael. We are here today to talk to you a little bit about blepharoplasty and brow lifts. Blepharoplasty is probably one of the easiest recoveries of any of the cosmetic surgical procedures that we do. And I'm going to use Carol here as my model to kind of demonstrate some of the things that we can improve on. So when we look at eyelids, we look at how much skin there is sitting on the upper lid as well as the brow position. And we'll talk about brow lifts in our next segment, but ideally we want the brow to be at or slightly above the orbital rim. And when you look at Carol, she has a little bit of extra skin that's sitting here on the upper lids, and we can treat that with an upper lid blepharoplasty surgery. And in that procedure, we hide the scar up in that eyelid crease, and we remove this extra skin, and sometimes there's even extra fat that falls forward with this procedure. The good news is there's always going to be at least a little bit of extra skin on the upper lid, because if we took off all the extra eyelid skin, we wouldn't be able to close our eyes, and that obviously would be very bad. But the eyelids, they heal incredibly quickly. Stitches come out in about 3 to 4 days, and most people, if we're talking about upper eyelids, can be back out in public within 5 to 7 days after the procedure. Lower lids, sometimes Carol doesn't have any of this, but sometimes we'll have fat that falls forward in the lower lid area. And in that case, it can look puffy, it can look baggy, and we treat that with an incision that's usually about 2 millimeters below the edge of the eyelashes, and then we bring it out into the little crow's foot wrinkle. And with that procedure, we can remove some of the fat that's fallen forward. Oftentimes, we'll tighten the lower lid muscle and remove some extra eyelid skin as well. So this diagram here depicts kind of an upper and lower lid blepharoplasty surgery. And this is the typical outline of skin that we would excise, and the fat itself kind of bulges forward. We remove some of the extra fat. There's actually 2 fat compartments to the upper lid and 3 fat compartments to the lower lid. And then when we close this incision, the scar falls very naturally in that eyelid crease. This shows you kind of the standard lower lid blepharoplasty, again, a little bit below the edge of the eyelashes, bringing it out into a little crow's foot wrinkle. What it doesn't show is that actually we do usually tighten the lower lid muscle, and we do that sometimes by bringing the tongue of that muscle up into the upper lid, and that's called an orbicularis sling, and that can help tighten the lower lid muscle and smooth out the lower lid contour as well. So that kind of gives you an idea of what's involved in an upper and lower eyelid blepharoplasty. Sometimes the upper lids might be covered with insurance if the hooding is so severe that it blocks the vision. I hope this has been informative, and we invite you to go to our website at pvps.com or give us a call for any further information about this or our other procedures. Thank you for your interest.